Hi, I'm Dr. James Mattingly, and I have the distinct honor of being with one of our awesome patients today named Barbara. We're going to talk with Barbara for a couple minutes about her experience and her history with obstructive sleep apnea. So Barbara, you came and saw us a handful of months ago.
Yes.
And tell us why you made that first visit.
Well, I have been struggling with lack of sleep for a number of years. And at first I thought it was too much stress at work. And then I thought maybe it's because of menopause. And then when it got to postmenopausal, I gave up and I went to my doctor. My doctor suggested that I get a sleep study.
Okay.
And that's how I found out that I had sleep apnea.
Now, a lot of times physicians, when they diagnose sleep apnea, they will go to their first line of defense, which is a CPAP machine, which most people know, big mask. What were your thoughts on that?
I did not want to do a machine at all. And my husband has sleep apnea and he has a machine.
Okay.
I know technology has gotten better. I did a little bit of research on it, and I do know that there are oral appliances available, and I really wanted to research that.
Awesome, and that's kind of through the lines of communication, how you came to see us.
Exactly.
Because we're really passionate about this in our office, helping, truthfully, sometimes helping save lives when it comes to sleep apnea. It can be very dangerous. So Barbara came to see us, and we made her a sleep appliance. And I'm not sure how well you can see on the video, but there are a lot of different sleep appliances on the market. We call these mandibular advancement devices. I chose a company called ProSomnus for Barbara because I really like the simplicity of their design and the functionality of the appliance and the track record of the appliance. So we made this for you.
Mm-hmm.
And so tell me how you've been doing in the last few months that you've been wearing it.
Well, I've been doing great. I think it took about 2 weeks to get used to it.
Yeah.
It was like when I got my braces off when I was younger, getting used to a retainer.
Yeah.
So if you've had braces in the past, that's what I would liken it to. So after a couple weeks of getting used to it, I actually started sleeping. And now I sleep through the night, and my energy level is better. My husband's thrilled because I'm not grouchy anymore. So it's all good.
And not only just are you feeling better, but you actually had another sleep study done. And in the world of sleep apnea, oftentimes patients get diagnosed with either mild, moderate, or severe sleep apnea. And I know from Barbara's history that before she had this made, she was a kind of upper moderate case. And after she had this made and has been wearing it, your results were not only beyond mild, they were actually out of the range of sleep apnea.
It's gone.
You're gone. You're in a healthy range of sleep and breathing.
Yes.
Which is really amazing. I mean, we see these kinds of changes a lot, but your case in particular, you don't necessarily fit the stereotype that we a lot of times see with sleep apnea. You're very fit, you're very trim, you're very healthy, and yet anatomically, you've had this challenge. And now, thanks to this ProSomnus device, you're sleeping better than ever, and your sleep apnea is gone, essentially.
I know, it was great. And after my last sleep study, my sleep doctor actually told me that it was gone and said, come back and see me in a year.
Awesome.
So it's been great.
Love it. Well, I really thank Barbara so much for spending a few minutes to talk about her experience. And she's just a joy anyways. And I'm so happy for you that this has changed your life in such a great way.
It's been great.
Thanks. We'll have another segment next time with someone else, but for today, doesn't get much better than this. Thanks, Barbara. So as Barbara and I were talking, one other thing I think is really cool to share, we're very honored by, is our practice is here in Walnut Creek. Tell us where you came from to come see us here.
I came from Livermore, and I had such a great experience getting fitted for the ProSomnus appliance that I have now made Dr. Mattingly my regular dentist. So there are lots of dentists between Livermore and Walnut Creek, but the service is so good here that I drive from Livermore 4 times a year because I get my teeth cleaned every quarter. So that's how good this practice is.
Thank you. We're humbled and honored. We certainly try our best. We're not perfect, but we're made perfect by people like you. So
Well,
thank you,
thank
Barbara.
you.
Okay.